I make a LASIK patient feel at ease? How do I counsel a LASIK patient about what to expect the day of surgery and after surgery? I work for a group of LASIK surgeons, and one of my duties there is I'm a LASIK counselor. It is my responsibility to help patients feel at ease so that they know what to expect the day of surgery and after surgery. Today, I will teach you what you should tell a patient about the day of surgery, what you should tell them about their aftercare, and help relieve the anxiety that they would have about having LASIK surgery. First, I'm going to tell you what to tell a patient about the day of surgery. Second, I'm going to tell you what to tell a patient about their aftercare. And third, I'm going to tell you what to tell the patient once the surgery is over and they are headed home. Okay, so I'm going to go ahead and put my PowerPoint on, and we're going to talk about LASIK counseling. First, we're going to talk about the day of surgery. You'll be here for an hour and a half from start to finish the day of surgery. You're going to check in at the designated area, and then one of our LASIK counselors will take you down to the laser center area. You will be greeted by a courteous and friendly person down at our laser center. Your procedure consent will be explained and signed. Then we'll offer you your value. That's where we take the anxiety away. You will be prepped for surgery, and the laser staff will explain the procedure step by step. Then you will meet your surgeon, and he will answer any of your questions. He's going to talk to you about 3 essential pieces of equipment: the Intralace IFS, the Vizec Star S4, and the Wave Scan. The Wave Scan does the mapping of the cornea. That has already been done on your pre-op day, and that information has been loaded into the laser for your treatment. The Intralace IFS is the laser that will make the flap in the cornea. And then the Vizec Star S4 is the laser that's actually going to reshape the cornea. So after the doctor has explained all of that to you, you'll be taken into the laser suite and placed on a comfortable laser bed. At that time, you'll be covered with a warm blanket, and we give you little stress balls to hold on to. We have little hearts for the ladies, and we have basketballs and soccer balls for the manly men. So the surgeon and the laser center staff will tell you step by step what is going on. They're going to first tell you that the flap is being made. It's during that time that the patient feels the most discomfort and the most pressure. They're going to tell you that the laser is reshaping the cornea. And after that, the procedure is complete. It's less than 5 minutes per eye. We will then escort you into the exam room where the doctor will instruct you on your postoperative care. So let's talk about your post-op visits. He's going to tell you you do need to be seen for your 1-day post-op. That is mandatory. That'll either be with our staff or with your referring optometrist. You need to be seen for a 1 to 2 week postoperative visit, and then at a 2 to 3 month visit. It is at that time that we will talk to you about if you were to need an additional surgery or a touch-up surgery. About 5% of our patients will need that. You need a 6 to 9 month postoperative visit and a 1 year visit. Then the doctor's going to talk to you about how things went that day. Everything went perfectly. Now we just wait for your body to do its part. The eyes do not heal the same, and no 2 patients heal the same. Patients are instructed to go home and keep their eyes closed for the first 3 to 4 hours after the surgery. They're going to experience some burning, stinging, tearing, and some light sensitivity. Their vision's going to be foggy the rest of the day. That's to be expected. And we tell them no rubbing, touching, or squeezing or pressure for 2 months on the eye. I think there's a song about that. So, okay, we're going to talk about what to tell the patient about their medications and their restrictions. The patients will be using 2 drops the day after surgery. They'll be using an antibiotic drop and a steroid drop. They'll be using 4 times a day for 4 days, and then they will discontinue that. They will be using preservative-free artificial tears to help with dryness and irritation. for at least the first 2 to 3 weeks. No athletic activities should be done for the first 48 hours. We also tell the ladies no makeup around the eye for the first 3 days. No swimming or water sports for the first 2 weeks, and no swimming or water sports in a lake for at least 1 month. So after that, it's time to prepare the patient to go home. Their goggles will be placed on. The patient is told that someone will call them later this evening to check on them. They will also be given the after hours on call number in case they need. And then now the patient is ready to go home and will be released to their driver. So at this time, I'd like to say that patient care is extremely important for our practice. We strive to give the best patient care that we possibly can, because when we have a happy patient, we have a patient who is motivated to share about their experience with others. And that brings referral patients into our practice to grow our practice. So a happy patient makes a great day. Thank you for allowing me to share with you about LASIK counseling. Thank you.